gonna keep releasing and working on the hips so that our lower back can work optimally and we can relieve that lower back pain and discomfort. And this is gonna really highlight one of like my favorite things about collaborating with experts who have different expertise or background than me, because like I'm coming from like a coaching, training point of view, and you're coming from your body work expertise, and it's really cool to see how the different techniques kind of mesh and they can complement each other. And I think this is going to be a really good example of that. So what we're going to do now is we're going to just kind of cover the rim below, like the rim of the hips. And we're going to get two really important areas. We're going to get the TFL, which is kind of a muscle. It turns into your IT band, or it highly connects your IT band, but it's kind of where your hand would go into your pocket. And then we're actually going to get into some of the glute muscles around the back. So for this one, we're going to isolate one ball in the Moball Roller, get the other one kind of out of the way. So one ball is right at the end. And you want to position yourself so that initially you can have just a little bit of weight right where your hand, or I would say a little above where your hand would go into your pocket. So if you can see me, if you have weird pockets, just use me as a reference, but most people, their hand's going to go into their pocket just like that. So Julia's going to kind of get down like she's going to do some sort of plank, and it really doesn't have to be perfect at first. What we want to avoid is the bony parts of the hips. We definitely want to be below the bony crest of the hips. And you want to be, the one thing we do want to be careful of is if you ever feel a strong pulse, like the pulse, like blood running through your veins, you want to move off that area. There are some major blood vessels in this area. No, nothing, if you just touch on it, not a big deal, but once you feel that pulsing sensation, kind of just move along to somewhere else. But so to begin with, Julie, let's actually have you tilt a little bit forward like you're going to do more of a forward plank, but still being on your side. And without being super worried about exactly where you are, let's just cover kind of from above that pocket area, and over the span of about 2 minutes, we're going to work our way around to the glutes. And the way I like to do it is just like if someone was just doing like a kneading massage with their thumbs, you're just going to very slightly shift your weight back and forth. No joint movements on this one. We're just doing like a kneading massage. We're going to get that TFL area. There are some other muscles that insert that are hip flexors, such as your sartorius, your quadricep muscles. So you might even touch on those and the fascia that connects to those. And then maybe after about 30 seconds of that one spot, Julia's going to lift her weight and she's going to scoot a little bit more directly to the side. Again, trying to avoid anything that feels like really bony or like there's not too much soft tissue. And we're going to do the same thing here.
Oh, that's so good.
Yeah, breathe deep. Some of these areas can be really intense. Like you might put your weight and it sends like a mini shock through your body, and just take a deep breath, maybe take a little weight off and then ease back into it. That's pretty normal. Beautiful. So again, about 30 seconds. You can go a little bit longer if you would like. And then we're going to just do one more adjustment, but you're welcome to do 4 or 5 adjustments on your own. Now she's going to lift her body up and she's going to actually slightly tilt back. She can put her foot back here as a support. And now we're a little bit into the backside, the upper glute area. And that's going to feel a little bit different. Yeah, good.
Ooh, yep.
Just that kneading massage kind of motion, letting everything just kind of melt like butter around the ball and the Moball Roller. Again, if you're not pressed on time, keep exploring more into the glutes so you can go down or a little bit more around the corner. But if you hit those 3 key adjustments, you're going to get a really good release of the muscles that we're going after.